hear stage 4, I just will never forget the look on his face. And he just broke down and said it's everywhere. From that moment until a month later, I felt like I had a gun to my head 24/7. And I just didn't know when it was going to go off. I was pregnant in 2020, 2021. I threw up every single day of my pregnancy. I only gained 7 pounds the entire time. I had severe nausea, and milk never came in my right breast. The lactation consultant thought maybe it was just my inexperience, but she also said sometimes that just happens. So I didn't think too much of it. I got really frustrated, so I just switched to formula. And I did tell my OB about it, but she didn't seem very concerned. She did order a mammogram because I had shared that I wanted to have another child quickly because I was old. I was 36, geriatric. And I have dense breast tissue, but nothing popped on the mammogram. I did have 2 later miscarriages. I think it was 12 and 14 weeks in between my daughter and my son. And during that time when I was pregnant with those 2 miscarriages, I noticed that my right nipple was kind of slightly inverting, but my girlfriend, I had asked her something. She had 2 older children. She was like, oh yeah, like my nipple's inverted. Like, it's just weird. They just suck me dry. And I thought it was odd because, as I said, I couldn't breastfeed, but I just kind of didn't think too much of it. As soon as the miscarriage was over, my nipple went back looking normal. So then when I had my son, I wasn't nauseous like I was with my daughter, but I was exhausted and like my bones hurt. I just remember not being able to get out of bed and just like it hurt to roll over. I just went to the hospital one day and I was like, get this baby out of me. We didn't know it, but the cord had been wrapped around his neck twice, so we had to do an emergency C-section. When you have a C-section, they want you to walk immediately. And that's the first time I really noticed my hip pain. I remember thinking like, oh my gosh, I cannot even put weight on my right hip. And I was having really difficult walking. And they're like, oh, well, during labor, maybe something just like didn't pop back into place. And so it got worse and worse as I got home. And so I went to a physical therapist who x-rayed me. And I was actually doing physical therapy for my hip. But I just always find that so fascinating that, I was pregnant, I was going to the doctor, I was even doing physical therapy. And it's just like, how did all of this get missed? My annual was 4 months after I had my son. I mentioned the nipple thing because it hadn't popped out like it, normally had. And it was starting to like feel weird. And so my OB was awesome and he ordered a mammogram right away. And they immediately said they needed a second look after I had, the first scan. It just so happened that the radiologist on call, I did not plan this, was a girl I've known since I was literally 4 years old. We went to junior kindergarten all the way to 12th grade together. And she came in, she was so lovely. She held my hand, walked me through it, and did the biopsy herself. She was the one that called me. And when I knew she called me from her cell phone, I just knew it was probably not good and that I had cancer. My tumor wasn't that large. So everybody kind of thought that we had caught it super early. It just sounded like everything was going to be okay. But we met with the surgeon. They did the biopsy on the tumor and they found out it was hormone positive. And again, everybody was just like, you're just going to do a double mastectomy and chemo and you're going to be fine. And so we did a lymph node biopsy. And I guess when it's spread to your lymph nodes, you can usually visibly tell. That was not the case with me. Apparently it looked really great on me, but there was something in my armpit that popped. So she wanted to do a full PET scan. And that's just when the bottom fell out. She was wise and called my husband, not me, first. I just will never forget the look on his face. And he just broke down and said it's everywhere. From that moment until a month later, I felt like I had a gun to my head 24/7. And I just didn't know when it was going to go off because, you hear stage 4, you hear all these scary things and you're just like, oh my gosh, what am I going to do? I was told by my husband, the surgeon told him that, you know, people that had scans like mine, you know, a few of them live, you know, a couple years. I started with tamoxifen and Verzenio, which I'm still on. They also did Lupron, which suppresses my ovaries because, you know, they're putting me into menopause, which is super fun. Like when you hear like you have stage 4 cancer and then they're going to put you in menopause to potentially save your life, you should probably just be like, great, thank you. Yeah, like, yes, let's do that. But I definitely had some reservations. You know, people talk about hot flashes and just how horrible it is. But I think you just have to focus on the fact that, you know, you're doing this to potentially save your life or prolong your life or however you want to look at it. And at the end of the day, the side effects, for me personally, they were not that bad. I think I was worried about not being attractive to my husband or, you know, losing that intimate side. But I've just made a really intentional effort to continue to put myself together and have date nights. And I'm trying. It's all you can do. I wouldn't say it's easy, but I think as long as you do your homework, and that's all you can do. They also give me a shot every 3 months. It's a bone hardening drug. That has actually been my regimen since day one, and that's what I'm still on. I did have radiation because I could not walk, and that helped tremendously. Like that my quality of life immediately improved. You know, I couldn't ride my horse. I was having difficulty walking. I certainly like couldn't throw a saddle on the back of my horse. I couldn't really ride well or for long because of my hip, but it didn't stop me. I never stopped. The year I was diagnosed in 2024, I think I finished 11th in the nation out of like 2,000 for my division. And then last year in 2025, I think I finished 19th out of about 2,000 horses in my division. Motherhood is why I'm fighting as hard as I can, but like horses are why I'm able to breathe. I mean, it's just being outdoors, and I love the smell of horses and hay, and there's just a calmness. You forget about everything. You forget all about your problems, and you're just kind of focusing on your relationship with this horse, especially when you're riding. They never asked me about my cancer, and that's like such a blessing. Like just that silence, and just, you know, they put their head on your shoulder or they nuzzle you. They just never stopped loving me. And I think I get so tired of like, how are you feeling? How are you feeling? How are you feeling? And I'm just riding and doing what I've always done. And it's so funny because if I ever post a video on social media of me riding my horse and winning, people are like, you look so strong, like good for you. I'm glad to see. And I'm just like, I am fully capable. I am strong. In some ways, I feel better than I have in years. My oncologist, you know, she's like, you have a hole in your hip. So like, if you fall off your horse, I'm going to need you to fall like off the other way. And so that's always in my mind sometimes. But I'm just, life is too short. I want to do what I love. I don't want to be scared. And I'm just going to do what I got to do. I would say 95% of the time, I'm positive. I'm trying to live my life normally and make people forget. And then there's like 5% of the time where I just like fall apart and I'm like, people have no idea what I'm going through right now, because I just feel like the bottom could fall out at any time. And the next time I go to the doctor, like, even though I've had all these great previous visits, like, what if? It's really the mental toll for me that is the worst part of my treatment, because, you know, you would think fewer appointments would be better. And it is. And I'm very grateful that I only have to go every 3 months, but it truly is every time they do a blood draw to see my tumor markers, or I get a scan every 6 months. I feel like I live my life in 3-month increments, and I can't really plan past that. I'm definitely living my life more intentionally and also gratefully. Like, you know, I'm a mom to 2 small kids, and I think sometimes I used to get frustrated with, you know, just like the day-to-day, like getting them up, cooking them breakfast, taking them to school, cleaning the house, picking them back up. And I think it's really easy to get stuck in that grind and a little lost. But now I have a completely different attitude of what a privilege, like what a privilege that I get to do this every day. And please, God, give me, 15 more years at least so I can see him through high school. It's really important to me right now to, not in a morbid way, but keep marking things off of my bucket list because I want to live. I want to have memories. And I'm driving my family crazy because I take professional photos like at least once a month because I want, if, heaven forbid something happened to me, like I want my kids to have these memories. I'm just trying to pack in as much of those like epic things as I can because, as I said, I just live in like 3-month increments and I'm just so scared. I hope that I live for 20 years or like decades and not just, 5 years. And I fully believe that that's going to happen. So I hope is kind of just another word for what I'm manifesting. So hopefully we'll be here.
Thank you so much for watching. If you were inspired by this story, we've queued up another one for you here. And please make sure you subscribe to the Patient Story community, where we're humanizing cancer one story at a time and always reminding people you're never alone.